Hello, friends, both foreign and domestic. Greg Friedman here with another rant. I've seen a number of you question why we would need to see a patient more than just a few times. And I've got to admit, I thought to myself, what the fuck? Until that is, I started talking to more and more of you. It seems that many of you, especially those who have been in practice for 15 years or less, are treating patients with acute injuries as opposed to chronic pain. But for those of us who've been seeing patients for more than 15 years, many of us see more chronic pain patients than we do acutely injured patients. The other day, my friend Len Fay, you all know and love him, made a comment about seeing some patients over many months or even years, and I watched all the younger heads just explode. You thought that was nuts. But I was nodding my head because I knew what Len was talking about. So let's talk about some of the differences first. You can look this up and get several definitions, but basically it's like this. Acute pain can be defined as less than 3 months of duration, although Medicare defines it as less than 4 weeks of duration. Chronic pain is almost universally defined as being greater than or equal to 3 months of duration. So then you could get a subacute pain, which is kind of in the middle, and some definitions you'll see subacute defined as between 4 weeks and up to 3 months of duration, and other times you may see it as from 6 weeks and up to 3 months of duration. So you get the idea. Acute is going to be more about 4 to 6 weeks. Subacute will be between 4 and 6 weeks up to about 3 months, and then chronic will be more than 3 months. All right, so let's talk about chronic pain. Here's an article published by the McCourt School of Public Policy from Georgetown University on chronic lower back pain. So here's what they have to say. They say that nearly 65 million Americans report a recent episode of back pain, and that about 16 million adult Americans, which is 8% of adult Americans, experience persistent or chronic back pain. They go on to say that many people with back pain also visit chiropractors, although a lot of people with back pain are more likely to see a medical doctor than a chiropractor. But they say that back pain patients who see chiropractors report that they are more satisfied with their care than those who see medical doctors. And then patients who see chiropractors are more likely to say that their provider explained their treatment and provided advice on self-care. Some patients, though, have chronic and or recurrent pain. They either always have some level of discomfort, or they're fine, then they're not, then they're fine, then they're not. This really isn't maintenance care. I think it's easiest for us to think of maintenance care more as wellness care. These are patients who are basically asymptomatic and they like to get adjusted now and then. But for the patients with chronic and or recurrent lower back pain, I loved it when the Nordic Maintenance Care Program was published not too long ago. Even though the authors call it maintenance care, they really mean treatment for chronic and or recurrent lower back pain, not the wellness care. So here's what the Nordic Maintenance Care Program says. So the study concluded that the chiropractic maintenance care reduces the number of days of bothersome or activity-limiting pain with each new low back pain episode among patients classified as dysfunctional. And the maintenance care stabilizes the clinical course and increases the number of pain-free weeks between episodes. It goes on to say that it's not a cure that prevents new episodes, but rather a management strategy that reduces bothersome activity-limiting pain over time for a carefully selected group of patients with recurrent and persistent low back pain. Now let's visit some treatment guidelines. For this, we can visit our friends at Clinical Compass, formerly known as Council for Chiropractic Guidelines and Practice Parameters. Let's give a special shout out to our good friend Ron Faribaugh, who is on the panel for this. So the guidelines talk about frequency and duration for trials of chiropractic treatment. And you see they break it down into acute and subacute, recurrent flare-up, and chronic. So for acute and subacute, they say for a trial of care, it'd be 2 to 3 times per week for 2 to 4 weeks with a reevaluation at 2 or 4 weeks per trial. For recurrent flare-up, it'd be 1 to 3 times a week, depending on the severity, for a period of 1 to 2 weeks with a reevaluation at 1 to 2 weeks. And for chronic pain, it'd be 1 to 3 times a week for 2 to 4 weeks with a reevaluation at 2 to 4 weeks. And then they go into exacerbations, like a mild exacerbation of chronic or moderate severe exacerbation of chronic or scheduled ongoing care for management of chronic pain. And you can see that there's various stages of that. Now, let me explain something to you though. For these kind of patients, unless they are having radicular complaints, which usually they're not, the ortho-neuro exam isn't going to show you a whole lot, is it? So the biggest thing, if we go back to Medicare now, is going to be those functional outcome questionnaires, not the pain questionnaires, the functional outcome questionnaires. We're really looking at function here. They go on to say that for chronic presentations, exacerbations, and scheduled ongoing care for management of chronic pain, additional care must be supported with evidence of either functional improvement or functional optimization. Now keep in mind that these patients who would be getting this chronic or recurrent type care, which we used to call supportive care, these are typically not covered by insurance anymore. These patients are usually going to be paying out of pocket for care. One thing that keeps coming up for these types of cases, though, and which many chiropractors fail to do, is called a trial withdrawal of care. That means before you would release the patient from care, you would try withdrawing care from them, maybe for a couple of weeks, a month, or whatever. The purpose is to see how they do without you and simply doing their home care and exercises. When they come back to see you after this trial withdrawal, have the patient complete the functional outcome questionnaire again and see if it's significantly worse than before the trial withdrawal. This is how you can determine a reasonable interval between visits. Every now and then I get to review a Family Medical Leave Act case in which the chiropractor is asking for 6 more months of treatment. And I'm not exaggerating. The problem is they never did a trial withdrawal of care, so there's no evidence that the patient got worse without receiving treatment. Denied. Okay, so before you get all butthurt when you hear some of us veteran chiropractors talking about patients that we've been seeing regularly for years, understand that many of these patients have chronic and or recurrent pain, even with them doing their home exercises. I mean, you can even think about this financially if you want. Let's say there are 16 million adults in the United States with chronic and or recurrent lower back pain, as we saw earlier in the article published by Georgetown University. According to the American Chiropractic Association, in 2020, there were about 70,000 chiropractors. So let's do some math. If all 16 million of these patients saw a chiropractor, that would be 229 individual patients per chiropractor in the US. If each of these patients needed treatment at an average frequency of 1.5 times per month, that's 344 visits per month per chiropractor. And let's say you only charge $40 per visit. That adds up to $13,760 per month cash per chiropractor. And I bet that there's less than 70,000 chiropractors actually seeing patients in the US, and most of you are probably charging more than $40 a visit. So there's that. But I'm not in the US, you whine. Okay, let's talk about our Aussie friends for a moment. According to an article published in 2013, there are about 4,500 registered chiropractors down under. And according to an article published in 2016 by the Australian Institute of Health and Welfare, there were an estimated 3.7 million Australians who had chronic low back pain. Let's do some math again. That would add up to 822 individual patients per chiropractor. At an average frequency of 1.5 visits per month, that would be 1,233 patient visits per month per chiropractor. At $40 per visit, that would be $49,320 per month per chiropractor.
You cock-juggling thunder cunt!
Let's not forget Europe. According to Arthritis Research UK, about 16.9% of the UK population has back pain. As of 2019, the population of the UK was 66.65 million people. That means that about 11.3 million people in UK have chronic lower back pain. As of 2019, there were about 3,299 registered chiropractors with the General Chiropractic Council in the United Kingdom. That works out to 3,425 individual patients per chiropractor. At an average frequency of 1.5 visits per month per person, that would be 5,138 patient visits per month per chiropractor. At $40 per visit, that would be, are you ready? $205,520 per month per chiropractor. Are you kidding me? And I'm only talking about people with chronic and recurring low back pain. What about people with chronic and/or recurring neck pain or headaches? If you want to focus on patients with acute pain and you'll see them a few times because you're all that, well, that's just fine with me. Just know that you're going to have to see a shitload of new patients every month, so start getting good at YouTube and TikTok videos. Well, let me tell you something. If you want to do this, you're going to need to show your outcomes. I don't give a shit about insurance. I've been talking about cash paying patients this whole time. Document like a boss, measure functional outcomes, and quit being a little bitch about it. And there you have it. I know I started off all nice and chill, but then I got all riled up. I hope you can see the future that I see for chiropractic. It truly is exciting. But we better start doing this right, or else.